In the medical industry, there are many disciplines. They all share the goal of improving, saving, or changing lives. Join us as we meet the people, discover the technology, and explore the organizations of this vital industry. Maintaining health and well-being is often simply a matter of making sound, informed choices. Here's an example of a healthy practice that could make a difference. A traumatic brain injury is one of the most dangerous and misunderstood forms of head injuries. Commonly referred to as a concussion, brain trauma can result in permanent disability or even death. Nowhere has this become a bigger issue than in the NFL, where high-profile injuries have put a spotlight on the concussion epidemic.
When I was in the National Football League, I suffered a number of concussions. I mean, dating back to college. It's just the hardest part about a concussion is just the not knowing. It's not knowing if you're going to miss 2 plays or 3 plays or 1 week or 3 weeks. The uncertainty there, the uncertainty of what kind of life I'm going to lead once I leave the game. It's just a really tough situation to be put in as a 24, 25-year-old athlete.
In response, the NFL began focusing more on prevention, but little effort has been made on finding a treatment.
New rules, new helmets, and other preventive measures can certainly reduce the chance for concussion, but they don't do anything to treat the concussions that will always be part of the game. If all those preventive measures fail and a player still ends up with a traumatic brain injury, there needs to be something they can do to treat it.
Currently, the only treatment for concussions is rest and certain types of medicines that are meant to address headaches. But we believe to protect the players and the game of football as we know it, it is time to change the way we treat concussions. The drug we are developing at Prevacus is that change.
Prevacus has developed the first field deliverable pharmaceutical treatment for concussions. The company was launched in partnership with the Florida State University College of Medicine with research facilities at the Sid Martin Biotechnology Incubator in Alachua, Florida.
We're really excited about our new project. Our new drug represents a proactive approach to protect players and the game of football. While others are working on preventive measures and new methods to diagnose, we're developing a medical treatment that will protect players from the harmful effects of concussion and preserve the game. Rather than focus on rule and helmet changes, we focus on treating head injuries with medicine, just like we do any other injury.
In developing a treatment for concussions, Prevacus had 2 primary objectives. The first was to develop a safe and effective pharmaceutical to reduce or prevent long-term negative effects. These include post-concussion syndrome, post-traumatic stress disorder, and CTE, a degenerative disease of the brain. The second objective was to create a portable field deliverable application that required no specialized medical training.
If an athlete suffers a concussion, we can deliver the drug right on the field of play, which helps reduce the potential negative effects, speeds up recovery time, and reduces the chance of repeat concussions. By preventing the secondary cascade of events that occur following stress to the brain, we can improve outcomes immediately and prevent the long-term negative effects associated with the injury.
The Prevacus drug is administered nasally, allowing it to be delivered right on the field of play. The drug immediately begins to combat the effects of concussion, reducing swelling, inflammation, and oxidative stress in the brain.
Just imagine, our drug will be available to every sports trainer, team doctor, and ambulance associated with the sport. By treating the concussion in the brain, we can better protect athletes, speed up their recovery time, mitigate the long-term negative effects associated with brain injuries, and protect the integrity of the game of football.
Currently undergoing toxicology testing, Prevacus will soon enter human clinical trials for safety and efficacy measures.
Prevacus is focused on a scientific solution to the concussion epidemic. We believe that by working side by side with sports industry and military leaders, we can bring this groundbreaking medical advancement to every athletic trainer, military medic, and emergency medical responder that deals with the concussive events. It is important for us to continue our progress so that we can develop this exciting drug and change the way we treat concussions.